Welcome to Meditech Matters.
Welcome to episode 4. Today we'll be talking about cancer and various cutting-edge technologies that are being used to remedy it.
So before we dive into the technologies and also the socioeconomic parts related to cancer, we're just going to go through some general statistics about cancer. So in 2024, an estimated 2,001,140 new cases of cancer will be diagnosed in the U.S., and 611,720 people will die from the disease. As we know, it's extremely fatal. Into the types of cancers, prostate, lung, and colorectal cancers account for an estimated 48% of all cancers diagnosed for men in 2024. And as for women, as you may have guessed, breast cancer is very prevalent, as well as lung and colorectal cancer as well. And they will account for an estimated 51% of all new cancer diagnoses in women in 2024, for breast cancer, that is. And also, tracking back 2 years, as of January 2022, there were an estimated 18.1 million cancer survivors in the U.S., and the number of cancer survivors is actually projected to increase to 22.5 million by 2032. So we're seeing more cancer diagnoses, and also a fair amount of deaths, but the amount of survivors is actually projected to increase in the next decade, which is a very promising sign. And so now we're going to go into some of these new technologies that will hopefully help accomplish this projection.
The first newer therapy we'll be talking about today is T-cell therapy. So first, to explain what T-cells are, they're a part of the immune system and they develop from stem cells in your bone marrow. They also help protect the body from infection and may help fight cancer. And they're also called T lymphocyte and thymocytes. So the process is quite lengthy, which is one of the downsides of this treatment. It begins by a patient visiting the clinic, visiting any clinic where they have a machine that can collect T cells from their blood. It's sort of similar to a blood donation, but this process can take up to 6 hours. So after collecting the T cells from the patient's body, the T cells have to be sent to a lab where they're genetically modified using an inactive virus to introduce the CAR gene. This process can take several weeks. So when the CAR gene is put onto the T cells do a better job at recognizing cancers because they already are good at eliminating cancer in the body, but they have a hard time recognizing it. So when the CAR T cells, and CAR stands for chimeric antigen receptors, when they're infused, the patient's body does a better job at recognizing and destroying cancer.
That being said, T-cell therapy isn't necessarily the most refined technology. It is approved by the FDA to treat certain types of leukemia, lymphoma, and multiple myeloma, but that's all for now. And clinical trials only did begin in the 1990s, so it's not worrisome. It's going on a general timeline that makes sense for it to soon be approved for other types of cancer. However, the side effects of T-cell therapy are concerning. One of them is cytokine release syndrome, called CRS, and this is actually a common side effect, and it's when the body's immune system overreacts to the chemicals released by the T-cells. And the symptoms are like general flu symptoms or fever symptoms. It's fevers, chills, nausea, vomiting, diarrhea, sometimes fatigue or difficulty breathing. And CRS usually starts a few days after the infusion and lasts about 5 to 7 days. Now, I mean, it's not like a fatal syndrome by any means, but if we could eliminate this, it would be ideal to prevent more discomfort for the patients. But another one that is a little bit more worrisome is bone marrow inflammation. And this can happen when CAR T cells target the healthy B cells in the bone marrow instead, which is always a risk when you're using these genetically modified cells. So that can be pretty dangerous. Other syndromes, going back to the syndromes, is the CAR T cell related encephalopathy syndrome, CRES. And that is a side effect that also usually starts around day 5 after the infusion. So we're seeing a trend, like 5 days after the infusion is typically when these side effects kick in. So the patient may think that they're fine for a little bit, but then after a little bit, these side effects start showing up. And the symptoms of this are quite different than CRS. These symptoms include confusion, disorientation, and difficulty speaking. So this is like more of a like mental type of syndrome than CRS. And then there's also neurological toxicity. And this one is anxiety, sleepiness, confusion, difficulty walking, facial drooping, hallucinations, problems finding words, seizures, infections, headaches, or being unresponsive. So this one is probably the most worrisome out of the ones discussed so far. That is until we get to, I think this is the biggest reason why I'm not a big advocate for this technology. It's genotoxicity. So T-cell therapy actually has a potential risk that can lead to secondary cancers, which defeats the entire purpose of defeating cancer. So it's a little bit questionable on if they're going to be able to refine it to the point where it becomes valid. But as for now, I'm more of an advocate for the other technologies that we're going to discuss later on in this episode.
So a type of T-cell therapy that's a little more specified is AMTAGVI, and it's a tumor-infiltrating lymphocyte, or a TIL. So it's a therapy that's used in only advanced melanoma. This TIL therapy, it's, like I said, similar to T-cell therapy. So they extract T-cells from a patient's tumor specifically, and then they grow them in a lab and reinfuse them back into the patient's body. So AMTAGVI is a type of T-cell therapy, but it's way less refined and was only approved by the FDA in 2024, so super recently. This type of therapy is far less engineered than CAR T-cell therapy. And in a study, patients had an average response time of 1.5 months. And even then, the success rate was only 31.5%, which is pretty low. Because of those reasons, it's not very commonly used and is typically only a last resort options for advanced melanoma patients who have exhausted all their other options.
So the next technology that we're going to talk about is nanotechnology. So nanotechnology isn't just specific to cancer, but it's starting to become very useful in the early detection of cancer, which is extremely important because detecting cancer early just gives the patient in general such a higher chance of surviving. I mean, if you're diagnosed with stage 1 cancer, the success rate is generally pretty good. So nanotechnology is extremely important in that regard. So it can actually, there's two ways that it can function. So it can either passively or actively target cancer cells. So in the passive targeting, it takes advantage of how permeable, because tumors have leaky blood vessels, so they're extremely permeable compared to normal cells. So this allows nanoparticles to accumulate at the tumor site more readily than in normal tissues and administer the treatment. And in active targeting, nanoparticles are coated with molecules. These are usually antibodies or peptides that bind to receptors on the surface of the cancer cells. So this makes the nanoparticles recognize and deliver the payload directly to the tumor cells. So whether you're using passive or active targeting, the benefit is that it ensures the drugs or other therapeutic agents are concentrated only when they are most needed. So it reduces the damage to healthy cells and minimizes the side effects that you typically see, like nausea, hair loss, and immune suppression. So in general, just the main takeaway is that nanotechnology is super specific in where it targets. It's less risky, and I'm a big advocate for it because, again, early detection is extremely important.
Yeah, so I do agree with Zoham that nanotechnology has a very hopeful future because it is far more refined than these other technologies that we've talked about, such as T-cell therapies or the AMTAGVI therapy. So yeah.
So the important thing with nanotechnology also is that it helps with early detection because of how specific it is. So that's the main benefit of it.
Moving on to another technology, proton therapy is a newer type of radiation treatment. Patients who undergo proton therapy essentially undergo a proton beam that is precisely targeted to a certain or specific tumor. Highly energized protons are used to damage the DNA in cancer cells, and this treatment seems to have a positive future because of how the protons are non-invasive, painless, and very precise. The protons, like I said before, destroy the DNA of the cancer cell, which prevents them from multiplying. Doctors using proton therapy can tightly control these beams and only target them to tumor cells. This is good because that means proton therapy, like I said before, is minimally invasive, meaning it doesn't affect cells in the nearby area. Because of the specificity of the proton beams, proton radiation is found to have fewer and milder side effects than other normal types of radiation therapy. Because of this, it's also found to have potentially higher cure rates and the ability to treat reoccurring cancers. Proton therapy is also typically used for very sensitive areas such as the brain and the heart. When used on tumors in the brain, proton therapy can cause side effects such as fatigue, skin irritation, hair loss, or headaches. On the other hand, proton beam therapy has some downsides, such as the lack of insurance coverage and high costs. Because it's such a complex procedure, the machines and equipment used for proton therapy are very complex and expensive. Additionally, proton therapy requires longer planning time because your oncologist must do a thorough evaluation of your tumor, such as taking CT scans or other imaging to ensure that the process is smooth and very accurate.
So the next thing that we're going to talk about, I actually think this is really interesting. So it's less of a treatment per se than a way to identify treatments. We watched this video in AP Bio last year where fruit flies, or as the science community knows, Drosophila, were used as guinea pigs as like clones of humans. So essentially what happened is that researchers would take the mutations. So this is personalized per patient, which actually makes this so unique. It's a personalized treatment because everyone's mutations are different in the causes for cancer. So they take the DNA or the mutation in the human and inject it into a fly larvae. So the fly is essentially a clone of the human. And since it has the same genome, for the most part, the researchers can then begin testing different drugs to see how the fly reacts, and knowing how the fly reacts will help them see how the human will react. So it's mainly FDA-approved drugs, and you could make the argument that it's a bit unethical to the fruit flies because you are altering their genome and you are injecting them with artificial chemicals and they can die many times. But Drosophila is not exactly an endangered species or a species that the science community has taken much measure to prevent testing on. As we know, they're one of the main animals that are tested for majority of genetics, whether it's just the basic Punnett square for educating younger people. Drosophila are used for all this. So I don't think the ethical concerns in a sense are much of an issue here. I think it's more just that it's a shot in the dark because the scientists, obviously there's research behind which treatments and which drugs can be useful for the larvae, but there's a lot of testing that goes into it, and there's no guarantee that a person can get this fly with their personalized genome and actually have a drug be tested on it that's effective and that can work for them. So it's more of a stretch, but I just think it's extremely fascinating at the scope at which researchers are going to try and find these cancer treatments.
The downside of all these new technologies, such as the fruit fly therapy or any of the other ones we talked about before, is that a lot of these therapies are only accessible to the super wealthy. Chemotherapy alone can range from cost as high as $12,000 a month and around $48,000 a year, which is beyond the average annual income in the United States. Chemotherapy is the most basic and most common therapy for cancer, and it is still super expensive. This goes to show how other more advanced therapies that aren't as common are even less accessible to the general population, which shows how large of an issue cancer is. Hopefully, with so many new treatments being researched and so much money going into cancer treatment, this rise in new technologies will be coupled with higher accessibility for people of lower socioeconomic status.
And it's also important to note that cancer is extremely hard to prevent because while there are genetic factors that can make you predisposed to cancer, cancer is often caused by just freak mutations, whether that's cell division or it's radiation that damages cells. And then obviously there's also lifestyle things like diet and alcohol or obesity. That's all also associated with cancer. But the bottom line is that it is extremely hard to prevent, but we do hope that it can be cured more. So we really do hope that this projected increase in cancer survival rates does come into play, and hopefully these new technologies by that 2032 like estimated year will start becoming even more prevalent, so that in a decade from then we see this number boom even higher. So with that, we'd like to thank you for listening to this episode about heart treatments, and we hope that you tune in for our next episode.